Describe the critical steps in achieving and maintaining asepsis during a small animal abdominal surgery. How does failure in any step compromise surgical outcomes? Answer: steps to achieve asepsis. Preparation of the patient, shaving and antiseptic scrubbing of the surgical site using povidone iodine or chlorhexidine in concentric circles, sterilization of instruments, autoclaving instruments to ensure sterility, surgeon preparation, proper scrubbing, wearing sterile gloves, gowns and masks, draping, placing sterile drapes to isolate the operative field, intraoperative asepsis, use of sterile instruments, minimizing exposure of internal structures and avoiding breaks in sterile barriers. Compromises and consequences. Breach in sterile barriers can introduce pathogens, increasing infection risks. Improper instrument sterilization can lead to surgical site infections, SS. Contaminated gloves may transfer organisms into sterile cavities, leading to sepsis or peritonitis. Guidelines. Follow the American College of Veterinary Surgeons Act standards of aseptic technique. Dr. Adams is performing a skin graft on a dog with a traumatic skin loss. The graft site shows redness and swelling 24 hours post-surgery. Considering the principles of wound healing, what steps should Dr. Adams take to address this complication? Answer: redness and swelling may indicate early inflammation, a normal part of the inflammatory phase of wound healing, or an early sign of infection. Steps to address: assessment. Check for additional signs such as purulent discharge, odor, or fever which may indicate infection. Intervention. If signs are normal inflammation, monitor the wound closely, ensure adequate hydration, and maintain aseptic dressings. If infection is suspected, perform a culture and sensitivity test, start empiric antibiotics, and consider wound debridement if necrotic tissue is present. Support healing. Use topical agents like silver sulfadiazine to promote reepithelialization and reduce microbial load. Relevant rule: ensure adherence to the phases of healing. Inflammatory 1. 4 days, proliferative 4, 4 days, and remodeling 21 days. Explain the anatomical and clinical significance of the brachial plexus in canine thoracic limb surgeries. What complications could arise from improper surgical handling? Answer: the brachial plexus, formed by ventral rami of CT, provides motor and sensory innervation to the thoracic limb. Significance: surgical procedures such as limb amputations or thoracic surgeries require careful retraction to avoid nerve damage. Key nerves include radial nerve, extends the carpus and digits, median and ulnar nerves, flexors of the carpus and digits, muscular cutaneous nerve, flexor of the elbow. Complications: radial nerve paralysis, inability to bear weight on the limb, neuropraxia, temporary loss of motor sensory function, neuritis, chronic pain due to inflammation. Guideline: use blunt dissection and nerve retractors to minimize trauma. How do the anatomical variations in the vascular supply of the canine hind limb affect surgical decision-making during femoral head and neck excision for hip dysplasia? Answer: the vascular supply to the femoral head and neck is primarily from the medial femoral circumflex artery, MFCA, which branches from the deep femoral artery. Variations in the MFCA and its branches are common, especially in large breed dogs. Some dogs may have a dominant femoral artery supply, while others may have accessory or variant vessels contributing to the head of the femur. Surgical implications, intraoperative risk, inadequate identification of the MFCA during femoral head excision can lead to ischemia and necrosis of the femoral head. Decision-making: surgeons must be cautious when manipulating soft tissues around the hip joint to avoid compromising these critical vascular structures, which could affect bone healing or lead to a vascular necrosis of the femoral head post-surgery. Techniques for prevention: careful dissection, ligation of unnecessary branches, and preoperative imaging such as CT angiography can help identify variations in vascular anatomy, thus guiding surgical planning. Guideline: adherence to the ACVS standards of vascular exposure is crucial in such surgeries to avoid catastrophic complications like a vascular necrosis. What are the factors affecting wound healing in soft tissue surgery, and how would you manage a wound in a diabetic dog? Answer: wound healing consists of 3 phases: inflammation, proliferation, and remodeling. Several factors can impact this process, including systemic health conditions like diabetes mellitus, infection, and mechanical stress on the wound. Factors affecting healing: oxygen supply. Inadequate blood flow due to compromised vascular supply in diabetic animals can hinder oxygen delivery to tissues, slowing healing. Glucose control. Elevated blood glucose levels impair neutrophil function, which reduces the ability to clear pathogens from the wound. Infection. A contaminated wound will increase inflammation, impair tissue regeneration, and may lead to chronic non-healing wounds. Tissue tension. Excessive tension on the wound edges can lead to delayed healing or dehiscence. Management of diabetic wounds. Control blood glucose. Ensure tight glucose control pre and post-surgery, as hypoglycemia exacerbates infection risks and delays healing. Infection prevention. Employ broad-spectrum antibiotics early and culture the wound to adjust treatment based on sensitivity. Adequate blood flow. Consider using hyperbaric oxygen therapy to enhance oxygenation of the healing tissue. Guideline. The ACVS wound healing protocol advises the use of specific wound care practices for diabetic animals, including strict infection control measures and optimizing nutritional support for tissue repair. Dr. Williams is performing a splenectomy on a 7-year-old golden retriever with splenic tumors. During the procedure, she encounters substantial bleeding from the splenic artery. What steps should she take to achieve hemostasis while minimizing damage to surrounding tissues? Answer: immediate steps for hemostasis. Direct pressure. Apply direct pressure to the bleeding vessel with a hemostat to control blood flow temporarily. Vascular clamps. Use vascular clamps to control the splenic artery proximally and distally, reducing the bleeding from the splenic vessels. Electrocautery or ligatures. Once the vessel is isolated, ligate the splenic artery using absorbable sutures or cauterize the vessel if the tissue quality allows. Assess for bleeding sites. Inspect the surrounding tissues carefully for other potential bleeding points, particularly smaller arteries. Tissue handling. Avoid excessive traction on surrounding tissues, as this can cause additional vascular injury. Important considerations. Use of electrocautery or harmonic scalpel may be employed to minimize blood loss, but this should be used with caution to avoid collateral thermal injury to surrounding tissues. Surgical technique. Ensure that ligatures are placed correctly to avoid any future hemorrhage. Explain how proper tissue handling during surgery influences post-surgical healing, and discuss strategies for minimizing tissue trauma in abdominal surgeries. Answer: proper tissue handling is essential to minimize postoperative complications such as delayed healing, infection, and dehiscence. The key factors affecting tissue healing are oxygenation, blood supply, and cellular integrity. Excessive handling can cause mechanical trauma, leading to vascular compromise and tissue ischemia, which slows down healing and may cause wound breakdown. Strategies to minimize trauma. Gentle tissue handling. Use of traumatic instruments such as vascular clamps or thumb forceps and avoid excessive tissue retraction. Minimize tissue exposure. Limit the duration of tissue exposure to the surgical environment to reduce the risk of contamination and dehydration. Use of proper suturing techniques. Select appropriate suture material and techniques to avoid excessive tension, which could compromise circulation to the tissue. Maintaining blood supply. If possible, preserve muscle and nerve blood flow, as any interruption can result in muscle necrosis and delayed healing. Clinical guidelines. Follow the ACVS principles of tissue handling to prevent ischemia and improve healing times. Describe the biomechanical considerations that influence the choice of fixation methods in a femoral fracture in a large breed dog. What factors determine the success of external fixation versus internal fixation? Answer: biomechanics plays a crucial role in determining the best fixation method for femoral fractures, particularly in large breed dogs. The femur is a weight-bearing bone, and fractures must be stabilized to prevent displacement and facilitate proper healing. Biomechanical factors. Fracture type and location. Comminuted fractures may require internal fixation for more precise alignment, while simple, stable fractures may be suitable for external fixation. Weight and activity level. Larger dogs exert higher forces on the femur during weight bearing, which requires stronger, more stable fixation methods. Bone quality. In large breeds, the bone is often denser, requiring high tensile strength materials for internal fixation like stainless steel or titanium. External versus internal fixation. External fixation. Advantages: less invasive, quicker to apply, and does not interfere with bone growth in young dogs. Disadvantages: can be less stable in highly active dogs, risk of pin tract infections. Internal fixation. Advantages: more stable for larger dogs with higher weight and activity levels. It provides rigid fixation, ideal for complex fractures. Disadvantages: requires invasive surgery and can be more prone to complications such as infections or implant failure. Guideline. ACVS guidelines for fracture management emphasize using internal fixation for large dogs with comminuted fractures or when external fixation is insufficient for weight-bearing stability. Explain the clinical significance of the brachial plexus in small animal limb surgery and describe how injury to this plexus can affect post-operative outcomes. Answer: the brachial plexus is a network of nerves originating from the spinal cord (CC) in dogs that provides motor and sensory innervation to the forelimbs. It consists of several key branches, including the musculocutaneous, median, ulnar, and radial nerves. Clinical significance: surgical planning. Knowledge of the brachial plexus is essential during surgeries involving the shoulder or forelimb, as these nerves pass close to major structures such as blood vessels and the humerus. Injury risk: surgical procedures such as fracture repairs, limb amputations, or removal of tumors in the shoulder region can inadvertently damage the brachial plexus. Post-operative outcomes: injury to the brachial plexus can lead to varying degrees of limb dysfunction, including motor deficits, paralysis or weakness of the affected limb, e.g., inability to extend the elbow, difficulty with flexion of the shoulder, sensory loss, reduced or absent sensation in the forelimb, pain and discomfort due to nerve damage leading to potential chronic pain syndromes, e.g., neuropathic pain. What are the key principles of hemostasis during major abdominal surgery in a dog, and what are the potential complications if hemostasis is not adequately achieved? Answer: hemostasis is the process of stopping bleeding during surgery and is critical in preventing post-operative complications. Major abdominal surgeries, such as splenectomy or gastrectomy, pose significant bleeding risks, and failure to properly control bleeding can lead to life-threatening situations. Key principles of hemostasis: identification of bleeding vessels. Always identify and control major vessels before proceeding with tissue dissection. For example, during a splenectomy, the splenic artery and vein must be ligated to prevent excessive blood loss. Use of ligatures and hemostats. Vessels should be ligated with absorbable sutures or cauterized with electrosurgical tools. Vascular clamps should be used temporarily until permanent hemostasis is achieved. Use of electrocautery. Electrocautery can be effective in coagulating small blood vessels and reducing blood loss, but care must be taken not to damage surrounding tissues. Surgical field management. Proper positioning of the animal and use of surgical drapes to control the operative field can minimize contamination and optimize visualization of the bleeding site. Potential complications: hypovolemic shock. If bleeding is not controlled, significant blood loss can lead to hypovolemic shock, a condition where insufficient blood circulates to vital organs. Infection and delayed healing. Failure to achieve adequate hemostasis can lead to hematoma formation, which serves as a medium for bacterial growth, delaying wound healing. Rebleeding. Inadequate ligation or cauterization can lead to rebleeding, which may require further intervention and prolong the recovery process. Guideline. The ACVS surgical hemostasis protocol provides recommendations on achieving and maintaining hemostasis, emphasizing the importance of thorough vessel ligation and effective intraoperative bleeding management. What are the biomechanical principles underlying the choice of a tibial plateau leveling osteotomy (TPLO) versus extracapsular stabilization for cranial cruciate ligament (CCL) repair in dogs? Discuss the advantages and limitations of each technique. Answer: the tibial plateau leveling osteotomy (TPLO) aims to neutralize cranial tibial thrust by altering the tibial plateau angle, thereby reducing reliance on the cranial cruciate ligament for stifle stability. It restores more natural joint biomechanics and is ideal for large, active dogs. Advantages of TPLO include improved functional outcomes, decreased likelihood of arthritis progression, and long-term joint stability. However, it is complex, requiring advanced surgical skills, and may result in complications such as infection, tibial fracture, or implant failure. On the other hand, extracapsular stabilization involves suturing materials outside the joint to mimic the function of the CCL. It's simpler, less invasive, and typically used for smaller or less active dogs. Its major advantage is reduced surgical time and cost. However, it's less effective in larger, more active dogs where forces on the stifle joint are higher and it may fail under excessive load. Thus, TPLO is preferred for larger dogs, while extracapsular techniques work better for smaller breeds with less dynamic activity levels. Describe the anatomical considerations and step-by-step procedure for a lateral thoracotomy in the fourth intercostal space. How does the choice of intercostal space vary with the pathology being addressed? Answer: anatomical considerations for a lateral thoracotomy include identifying the fourth intercostal space as the most common approach for surgeries involving the cranial, lungs, or heart. The intercostal neurovascular bundle, located in the caudal aspect of each rib, must be avoided to minimize bleeding and nerve damage. The procedure begins by making an incision over the chosen ICS, followed by careful muscle separation. The rib is retracted using a rib spreader to provide access to the thoracic cavity. The choice of ICS depends on the pathology being addressed. The fourth ICS is preferred for surgeries involving the heart, great vessels, or cranial lung lobes. The sixth or seventh ICS is used for access to the caudal lung lobes or esophageal repairs, as these spaces offer better access to the mid-thoracic region. Each ICS approach is based on the location of the pathology, and the surgeon must assess the patient's size and specific surgical needs when selecting the appropriate space for optimal exposure. Compare the indications for internal fixation versus external fixation in long bone fractures in small animals. Include an analysis of potential complications for each method. Answer: internal fixation is often used for more complex fractures, particularly those involving articular surfaces or requiring precise alignment for proper healing. Techniques like plates and screws are ideal for fractures requiring high mechanical stability, such as fractures of the femur or humerus. The advantages include better long-term functional outcomes and faster recovery. However, complications can include infection, implant failure, non-union, or delayed healing. Moreover, internal fixation is technically demanding and costly. External fixation, which uses devices like external fixators or pins inserted through the skin, is commonly indicated for open fractures, fractures with significant soft tissue injury, or fractures requiring gradual lengthening. It is more versatile and can be adjusted during the healing process. However, external fixation often leads to pin tract infections and discomfort due to the external nature of the device. Additionally, the mechanical stability may be inferior to internal fixation, and there's a high risk of malunion if not properly aligned. In summary, internal fixation is favored for stable, complex fractures requiring precise alignment, while external fixation is ideal for unstable, open fractures or cases requiring significant external stabilization. Dr. Martinez is treating a 5-year-old Labrador retriever with a midshaft femoral fracture. The fracture is highly comminuted and contaminated due to a road traffic accident. Discuss the surgical decision-making process and the choice of fixation method. Justify your approach based on the specific clinical scenario. Answer: for a comminuted and contaminated femoral fracture, the surgical approach must address both the fracture stabilization and infection control. The primary concern is to prevent infection from worsening the healing process. In this case, an external fixation technique is often recommended. External fixators allow for stabilization while also enabling access to the wound for ongoing lavage and debridement. The fracture site can be cleaned thoroughly during surgery to remove any foreign debris and bacteria, and external fixation minimizes direct interference with the wound, reducing the risk of infection. Postoperative management should include antibiotic therapy tailored to the type of contamination found and close monitoring for any signs of infection at the pinch sites. Internal fixation could be considered at a later stage once the infection has been controlled and bone healing begins. However, the initial choice leans toward external fixation due to the significant soft tissue damage and the need for frequent adjustments in wound management. This approach not only stabilizes the fracture but also allows for better wound care and monitoring, making it the preferred choice in cases of severe contamination. Discuss the differences between autografts, allografts, and synthetic bone grafts in veterinary orthopedic surgery. Include their respective indications and limitations. Answer: autografts are bone grafts taken from the same animal, offering osteogenesis, osteoinduction, and osteoconduction. They provide the best biological healing and are preferred for small defects. However, they require a second surgical site, which carries risks of morbidity, pain, and complications like donor site infections. Allografts are bone grafts obtained from a donor animal. They provide osteoconductive properties, meaning they offer a scaffold for the recipient's bone to grow on. They are used when there is insufficient bone in the patient or when autografts cannot be harvested. Risks include immune rejection and the potential for disease transmission, which can limit their use in some cases. Synthetic bone grafts include materials like ceramics or bioactive glass that offer osteoconductive properties, but lack osteogenesis. They are particularly useful for large defects where autografts and allografts are not available. The limitations include slower incorporation and remodeling, as the body's natural healing process is slow to adapt to synthetic materials. Each type of graft has its specific indications based on the size of the defect, the need for biological integration, and the availability of donor material. Explain the pathophysiology of gastric dilatation volvula (GDV) in dogs. How does surgical treatment address the underlying causes? Answer: gastric dilatation valvular GDV occurs when the stomach becomes distended with gas and then rotates, leading to obstruction of both blood flow and gastric contents. The rotation causes the pylorus and cardia to move away from their normal positions, compromising the venous return and leading to shock and gastric ischemia. As blood flow to the stomach is disrupted, the tissue begins to die, releasing toxins into the bloodstream and leading to systemic complications such as hypotension, acidosis, and organ failure. Surgical treatment begins with decompression, usually via stomach tube or trocherization to relieve pressure. Once the stomach is decompressed, the derotation of the stomach is performed, which involves physically untwisting the stomach to restore normal anatomy. Afterward, a gastropexy is performed, which involves suturing the stomach wall to the abdominal wall to prevent recurrence of volvulus. This procedure stabilizes the stomach and reduces the likelihood of a second occurrence. Postoperative care includes fluid therapy, monitoring for shock, and addressing any complications such as hypovolemic shock or gastric necrosis. Analyze the importance of preoperative planning in correcting angular limb deformities. Include an example of how a closing wedge osteotomy is planned. Answer: preoperative planning for angular limb deformities involves comprehensive radiographic assessment, typically with both craniocaudal and lateral views, to measure the angle of deformity and determine the correct location for osteotomy. The goal is to achieve optimal alignment by selecting the most appropriate type of osteotomy, such as a closing wedge osteotomy. In a closing wedge osteotomy, the bone is cut to remove a wedge-shaped section and the remaining bone is closed to realign the limb. The angle of the wedge is determined by the degree of deformity, and the amount of bone removed is calculated based on the radiographic measurements. The surgeon must also assess the soft tissues, as improper muscle or ligament tension can lead to poor outcomes. In cases of distal fallen deformity, the osteotomy might be performed at the distal radius to correct a valgus deformity. Accurate planning helps avoid overcorrection, undercorrection, and complications such as non-union or malalignment, ensuring the limb's functional recovery. The surgeon must also consider factors like growth potential and the patient's age when planning the procedure. What are the critical surgical and postoperative considerations in canine thyroidectomy for treating thyroid carcinoma? Answer: thyroid carcinoma in dogs typically presents as a palpable mass in the neck region, often accompanied by symptoms of dysphagia or hoarseness. Surgical treatment is the gold standard, but it requires careful planning. Surgical considerations include careful dissection to avoid damage to the recurrent laryngeal nerve and the parathyroid glands. A complete thyroidectomy is performed, which involves removal of the thyroid gland while ensuring that the surrounding structures, such as blood vessels, are carefully preserved to avoid complications. Postoperative considerations include hypocalcemia due to inadvertent damage or removal of the parathyroid glands, which may lead to tetany or seizures. Therefore, calcium supplementation is often required. The dog should be monitored for signs of hypothyroidism, weight gain, lethargy, which may necessitate lifelong thyroid hormone supplementation. Additionally, radiation therapy or chemotherapy may be considered as adjunct treatments for any residual tumor or metastases. Discuss the management of intervertebral disc disease in dogs, including surgical and non-surgical treatment options. Answer: intervertebral disc disease, IVD, is a condition where the intervertebral disc degenerates, leading to compression of the spinal cord. It typically affects the thoracolumbar and cervical regions in dogs, especially in chondrodystrophic breeds like Dachshunds. Non-surgical treatment is typically recommended for mild cases where rest analgesia and anti-inflammatory medications are prescribed. This conservative approach can be effective in managing pain and preventing further injury. For more severe cases or when conservative treatment fails, surgical intervention may be necessary. A hemilaminectomy or ventral slot procedure is performed to decompress the spinal cord by removing part of the vertebrae and disc material. Surgery is generally recommended for cases involving loss of deep pain sensation, paralysis, or severe pain. Postoperative care involves pain management, physical rehabilitation, and gradual reintroduction to activity. The success of surgery depends on the severity of the neurological deficits before surgery and the timely intervention. Describe the pathogenesis of hip dysplasia in dogs. How did different therapeutic approaches, including surgical and medical management, address the condition? Answer: hip dysplasia is a developmental orthopedic disease characterized by abnormal hip joint formation, resulting in joint instability and osteoarthritis. It primarily affects large dog breeds and is influenced by both genetic and environmental factors such as rapid growth and obesity. In hip dysplasia, the acetabulum hip socket does not develop properly, leading to improper alignment between the femoral head and the acetabulum, resulting in joint laxity and wear on the cartilage. Over time, this causes pain, stiffness, and a decrease in joint function. Medical management includes pain control using NSAIDs, joint supplements like glucosamine and chondroitin, and weight management to reduce stress on the hips. Physical therapy and low-impact exercises can help maintain muscle strength and improve joint mobility. In more severe cases, surgical interventions are required. These include procedures such as femoral head and neck excision, FEO in small dogs or those with severe arthritis where the femoral head is removed to eliminate the painful joint, triple pelvic osteotomy (EO) for younger dogs with mild hip dysplasia, which involves cutting and repositioning the pelvic bones to improve the alignment of the hip joint, total hip replacement (EHR) for dogs with advanced degenerative changes, offering the best long-term outcome, restoring function and relieving pain. In conclusion, early diagnosis and a combination of medical and surgical treatments tailored to the severity of the condition are essential in managing hip dysplasia and improving the dog's quality of life. Explain the principles behind the stabilization of vertebral fractures in dogs. What are the biomechanical considerations and how do they influence the choice of stabilization technique? Answer: vertebral fracture stabilization aims to restore spinal alignment and prevent further damage to the spinal cord. Biomechanical principles include load distribution, tension bands, and anchor points. The stabilization system should bear axial, rotational, and bending forces without compromising spinal stability. Tension bands, such as those used with screws and rods, convert tensile forces into compressive forces, thus providing strength. For anchor points, pedicle screws are commonly used in intact vertebral bodies adjacent to the fracture. Surgical techniques vary depending on the fracture type, dorsal, ventral, or lateral approaches. For dorsal fractures, a combination of dorsal laminectomy and stabilization using plates or cross pins is used. For ventral fractures, ventral plating or pinning techniques are preferred. Biomechanical factors such as fracture type, location, and spinal cord injury severity guide technique selection. Imaging ERI is essential to evaluate fracture stability. The goal is to restore vertebral alignment, avoid excessive motion, and facilitate healing while preventing spinal cord compression. What are the steps involved in sentinel lymph node mapping, and how does it contribute to oncologic surgery outcomes? Answer: sentinel lymph node mapping is a technique to identify the first lymph node likely to contain metastasis from a primary tumor. It is important for accurate staging and guiding treatment. The procedure involves several key steps: tracer injection, a radiolabeled colloid or blue dye is injected near the tumor site. Imaging techniques like lymphoscintigraphy or near-infrared fluorescence are used to track the tracer's path to the sentinel lymph node. Surgical identification: the sentinel lymph node is located and removed during surgery, guided by imaging or a gamma probe histopathology. The node is sent for examination to determine the presence of cancer cells. This method aids in determining if metastases is present, reducing unnecessary lymphadenectomy and improving postoperative outcomes. It allows for precise treatment decisions such as whether adjuvant therapies, radiation, chemotherapy are needed. The American College of Veterinary Surgeons (ACS) recommends this technique for tumors such as canine mast cell tumors, which have a propensity for regional metastases. Describe the ventral slot procedure for managing cervical intervertebral disc herniation. What complications may arise and how can they be mitigated? Answer: the ventral slot procedure is used to treat cervical intervertebral disc herniation, commonly in small dogs. It involves creating a ventral access to the cervical spine to decompress the spinal cord by removing herniated disc material. Key steps include positioning the patient in ventral recumbency with the neck extended, performing a midline incision, and exposing the vertebral bodies. A rectangular slot is drilled in the vertebral body to access and remove the herniated disc material. Complications include hemorrhage, spinal cord injury, and postoperative instability. Hemorrhage can be managed with careful dissection and hemostatic techniques, such as bipolar cautery. Spinal cord injury can be minimized by monitoring the spinal cord during surgery and avoiding excessive manipulation. Instability can be addressed by ensuring that no excessive bone is removed from the vertebral body, and if necessary, additional stabilization with screws or plates can be performed. Postoperative care includes pain management, anti-inflammatory medications, and physical therapy to promote recovery. ACVS guidelines recommend using advanced imaging ERI to confirm the diagnosis and plan the surgery. This approach is critical for ensuring minimal complications and optimal outcomes in dogs with cervical disc herniation. Discuss the indications for wide excision versus marginal excision in soft tissue sarcomas. What are the prognostic implications of each approach? Answer: in soft tissue sarcomas, surgical excision is a primary treatment option, with the decision between wide or marginal excision dependent on tumor characteristics. Wide excision involves removing the tumor with a generous margin of surrounding normal tissue to ensure complete excision of the tumor. It is preferred for tumors that are malignant, have ill-defined borders, or are high-grade. Wide excision provides the best chance for long-term control and minimizes local recurrence. Marginal excision involves removing the tumor with a minimal surrounding tissue margin. It is typically used for well-encapsulated, benign tumors or when the tumor is located near critical structures. While this method is less invasive, it carries a higher risk of local recurrence. The prognostic implications are significant. Wide excision generally leads to better outcomes, especially in high-grade or aggressive tumors. Marginal excision may require adjuvant therapy such as radiation to control recurrence. ACVS guidelines recommend histologic examination of surgical margins to ensure adequate excision and guide further treatment decisions. Dr. Green is treating Bella, a 5-year-old Labrador with severe hind limb paresis following a road traffic accident. Imaging reveals a tail vertebral fracture with compression of the spinal cord. What stabilization and decompressive strategies should Dr. Green consider? Answer: for Bella's condition, the talar vertebral fracture with spinal cord compression requires a two-pronged approach: decompression and stabilization. Decompression: a dorsal laminectomy should be performed to remove the compressing bone fragments or disc material from the spinal cord. This is crucial to alleviate pressure on the spinal cord and prevent further neurologic damage. Stabilization: pedicle screws and rods should be placed across the 2L vertebrae to provide rigid stabilization and prevent abnormal motion at the fracture site. This approach helps in restoring spinal alignment and preventing further injury. Postoperatively, Dr. Green should monitor Bella for signs of infection, wound healing, and the return of neurologic function. Physical therapy should begin as soon as possible to support rehabilitation. Imaging follow-up, e.g., radiographs or CT, may be necessary to ensure proper alignment and healing. The ACVS emphasizes early intervention as delays in spinal stabilization can result in permanent deficits. Dr. Green should also consider adjunctive pain management, including corticosteroids and analgesics, to reduce inflammation and discomfort. Explain the steps and considerations in performing limb-sparing surgery for osteosarcoma in the distal radius. Answer: limb-sparing surgery for osteosarcoma in the distal radius is an alternative to amputation, aiming to preserve function while effectively treating the tumor. Key steps include preoperative planning. CT or MRI scans are essential to evaluate the extent of the tumor and to plan for the surgical resection. Tumor resection: the affected segment of bone is removed, taking care to ensure clear oncologic margins. This may involve removing part of the radius and surrounding soft tissue. Reconstruction: reconstruction of the limb is achieved by using an allograft or endoprosthesis to replace the resected bone. The endoprosthesis is secured with plates and screws to provide mechanical stability. Stabilization: after reconstruction, the limb is stabilized with plates, screws, or external fixation devices to allow for proper healing and function. Considerations include the possibility of infection, mechanical failure of the implant, and the need for adjuvant chemotherapy or radiation. The ACVS guidelines recommend multidisciplinary management involving oncologists for the best outcomes. Limb-sparing surgery is indicated in patients where functional preservation is a priority, but careful planning and follow-up are crucial for success. Compare neuropathy and nerve grafting in peripheral nerve repair. When is each technique appropriate? Answer: neuropathy and nerve grafting are two techniques used to repair peripheral nerve injuries, with each being appropriate in different situations. Neuropathy: this technique involves directly suturing the two ends of a transected nerve. It is appropriate when the nerve gap is small, less than 1 centimeter, and the nerve ends can be aligned without tension. Nerve grafting: when the nerve gap is large and cannot be bridged with direct suturing, nerve grafting is performed. This technique involves using an autograft, usually from the sural nerve, to bridge the gap between the two nerve ends. Neuropathy is the preferred method for clean transections with minimal loss of tissue. Nerve grafting is used when the injury creates a gap that cannot be bridged directly, or when the nerve ends cannot be aligned. Early intervention is key to optimizing functional recovery. ACVS guidelines recommend timely repair to reduce muscle atrophy and scarring, which can hinder regeneration. How do differences in tumor biology between benign and malignant tumors influence surgical planning? Answer: tumor biology plays a crucial role in determining the surgical approach to tumor removal. Benign tumors: these are typically well-defined, slow-growing, and encapsulated, making them easier to remove with minimal risk of recurrence. Marginal excision is often sufficient for benign tumors as they are less likely to invade surrounding tissues. Malignant tumors. These tend to infiltrate surrounding tissues, making them harder to remove completely. Wide excision with a generous margin of normal tissue is preferred to ensure complete tumor removal and reduce the risk of recurrence. Malignant tumors may also metastasize, requiring lymph node sampling or additional treatments like chemotherapy or radiation. The surgical approach is guided by tumor grade, invasiveness, and location. For malignant tumors, imaging and biopsy are crucial for staging, while benign tumors often require less aggressive surgical strategies. ACVS guidelines emphasize tailoring the approach to the biological behavior of the tumor to achieve the best outcome. What is the role of early decompression in managing spinal cord injuries in dogs? Answer: early decompression is essential in managing spinal cord injuries as it directly influences recovery and long-term outcomes. Spinal cord injuries lead to inflammation, ischemia, and secondary neural damage, making decompression critical to preventing further deterioration of the spinal cord. Timing: early decompression, ideally within 1 to 4 hours, minimizes the extent of spinal cord damage and improves the chances of functional recovery. Techniques: surgical approaches such as laminectomy or hemilaminectomy remove compressive materials, e.g., bone disc material pressing on the spinal cord. Benefits: studies show that early decompression leads to better functional outcomes, reduces the incidence of chronic pain, and improves mobility in many cases. Delaying decompression can lead to irreversible damage, making early intervention vital for optimizing recovery. ACVS recommends careful assessment and imaging to determine the extent of the injury, followed by timely surgical intervention. Postoperative rehabilitation is also critical for full recovery. What are the primary concerns in postoperative care following oncologic surgery, and how can complications be managed? Answer: postoperative care following oncologic surgery involves addressing several key concerns. Pain management. Adequate analgesia is essential to promote recovery and prevent complications. Opioids, NSAIDs, and local anesthesia techniques are commonly used. Wound healing and infection prevention. Proper wound care and antibiotics are necessary to prevent infection. Regular monitoring for signs of infection, redness, discharge, swelling is critical. Adjuvant therapy. For malignant tumors, follow-up treatments like chemotherapy or radiation may be required to manage residual disease. Complications. Common complications include wound dehiscence, infection, and recurrence of the tumor. Monitoring for signs of complications allows for prompt intervention such as wound revision or additional therapy. Rehabilitation. Physical therapy helps maintain mobility and function, especially for limb-sparing procedures.